Hello guys, today we are going to discuss about a very commonly used group of drugs. Those are called as painkillers, which are also called as non-steroidal anti-inflammatory drugs or Nsaids, also called as analgesic antipyretics. These are the drugs which are very commonly used and the most commonly used over-the-counter drug around the world. So without wasting any more time, let's talk. In today's session, we will be discussing about the introduction of this chapter. Then we will briefly discuss about the mechanism of action of these drugs. Then we will try to remember the names of the drug in a simpler classification. Now, the Nsaids or non-steroidal anti-inflammatory drugs are chemically diverse drugs which are grouped in one category. They have got a common feature, that is, most of them are organic acids, and this property is very important from pharmacokinetic and pharmacodynamics point of view. These drugs are primarily grouped together because they have got some common features, such as they are analgesics, that means they will reduce the pain. They are antipyretic drugs with a property to reduce fever. They are anti-inflammatory drugs, mostly in higher doses. That means they will reduce the signs of inflammation such as swelling, redness, increased local temperature, or reduced functions or movement. The primary action is not through CNS depression. So there is very rare physical dependence seen. Similarly, abuse liability is also very less. But in ground reality, many people who have benefited from these drugs, they consume these drugs repeatedly to get rid of their pain and inflammation. Practically, they are weaker analgesics than morphine. But when the cause of pain is inflammation, means in case of inflammatory pain, these are better drugs. These are also called as non-narcotic, non-opioid and aspirin-like analgesics. They primarily act on peripheral pain mechanism with some effect on the central nervous system. If anybody is interested in knowing about the pain mechanism, both peripheral and central pathway, they can check the description section below. Now let us discuss about the mechanism through which these drugs are going to act. Whenever there is a stimulus which produces inflammation or injury, there is disturbance of the cell membrane. Now, due to disturbance and destruction of the cell membrane, phospholipids are released because we all know the cell membranes are lipoprotein bilayers. Now, these phospholipids are broken down into fatty acids, and one of those fatty acids is arachidonic acid with the help of phospholipase enzyme. Now, this arachidonic acid is acting as a prime compound which is responsible for production of pain, inflammation and also fever. Now, this process of conversion of phospholipids into arachidonic acid, which is catalyzed by phospholipase, can be inhibited by corticosteroids, which are actually phospholipase inhibitors. That's why corticosteroids are very potent anti-inflammatory drugs. Now, this arachidonic acid will enter either into LOX pathway with the help of lipoxygenase enzyme or into COX pathway with the help of cyclooxygenase enzyme. Now, through the LOX pathway, it will produce the different leukotrienes, but for this chapter's point of view, it is not very important. We will discuss in detail about the COX pathway, which is responsible for production of the compounds which are responsible for production of pain, inflammation and fever. These cyclooxygenases are actually inhibited by Nsaids or non-steroidal anti-inflammatory drugs. Now what happens? The arachidonic acid will either be converted into prostacyclin or thromboxane A2 or prostaglandin through different cyclooxygenases. There are primarily two types of cyclooxygenases. One is COX1, another one is COX2. There is another cyclooxygenase called as COX3, which is yet in research phase, that's why it is not established. We will not discuss in detail about that. Let us discuss about the COX1. Now these cyclooxygenases will act at different locations of our body to produce different molecules. For example, this cyclooxygenase 1 or COX1 is primarily a housekeeping enzyme or constitutive enzyme which is normally operational, which is needed for the normal functioning of different organs and organ systems of our body. For example, this COX1 will convert arachidonic acid into prostaglandin I2. This prostaglandin I2, which is also called as prostacyclin, is helpful in protection of the gastric wall because it helps in production of the bicarbonates and also secretion of the mucosa that protects the gastric wall from the acidic injury which is secreted inside the gastric lumen. Similarly, this COX1 helps in conversion of arachidonic acid into thromboxane A2 in platelets, and this thromboxane A2 is responsible for the platelet aggregation property. Now, if this COX1 will be inhibited, the thromboxane A2 will not be produced in substantial amount. That will result in reduced platelet aggregation. This property of inhibition of the COX1 resulting in reduced platelet aggregation is sometimes helpful, such as in conditions where there is increased platelet aggregation resulting in increased blood coagulation or clot formations, and that usually results in damage of the end organs, and in those situations the platelet aggregation inhibition can be life-saving. At the same point of time, whenever the platelet aggregation is normal, there is no need of platelet aggregation, inhibition of the platelet aggregation can result in increased bleeding tendency. So in smaller injuries also huge amount of blood can be lost. So this can be a side effect of these COX1 inhibitors or can be a therapeutic effect also, depending on the situation. Now coming to the COX2 or cyclooxygenase 2. This cyclooxygenase 2 is normally not a housekeeping or constitutive enzyme, but there are exceptions that we will discuss later in this chapter. Rather, it is an inducible enzyme. That means whenever there is inflammation, the inflammatory situations and inflammatory mediators will induce the activity of the COX2. Primary inducers are trauma, interleukin 6, interleukin 1, interleukin 8, which are actually pro-inflammatory interleukins. Now, after activation of the COX2, it will convert the arachidonic acid into prostaglandin E2, and this prostaglandin E2 is a very potent pain sensitizer and pro-inflammatory mediator. Now that will result in pain, that will result in newborn formation also, that will result in fever, and all the signs and symptoms of pain inflammation are propagated through this prostaglandin E2. So the primarily the non-steroidal anti-inflammatory drugs, which are the traditional Nsaids, will act on both COX1 and COX2 and inhibit them. There are few new selective COX2 inhibitors in Nsaids that preferentially or selectively inhibit the COX2. Similarly, certain anti-inflammatory interleukins such as interleukin 10 also inhibit COX2, reducing the production of prostaglandin A2 and reducing the signs of pain and inflammation. Now there are different methods of classification of these drugs. Here is a simpler method where the non-steroidal anti-inflammatory drugs are divided into non-selective COX inhibitor, then preferentially selective COX-2 inhibitor, then highly selective COX-2 inhibitor, then analgesic antipyretics with poor anti-inflammatory action. Under the non-selective COX inhibitors or the traditional Nsaids, first and the foremost drug is salicylates such as aspirin. The next group is propionic acid derivatives such as ibuprofen, naproxen, ketoprofen, flurbiprofen. Next group is phenamate, under which comes the mefenamic acid. Then comes the enolic acid derivatives, under which comes the piroxicam, tenoxicam. Then comes the acetic acid derivative, under which comes the ketorolac, indomethacin, nebumetone. Next come the pyrazolone derivatives, under which comes the phenylbutazone, oxyphenbutazone, then propyphenbutazone. Then came the preferential COX-2 inhibitors, which had less activity on the COX-1, under which came the nimesalides, diclofenac, aceclofenac, meloxicam, etodolac. The newest drugs under which the highly selective COX-2 inhibitors are celecoxib, etoricoxib, parecoxib. Then there is another group which have got primarily analgesic and antipyretic action, but they are very poor anti-inflammatory drugs, under which comes the para-aminophenol derivatives. The drug is paracetamol or acetaminophen. Then the benzoxazosine derivative. The drug is nepopam. So we will try to remember as much names as we can. That much is enough for today. Take care, be healthy and keep smiling. Thank you.